so this is video 2, and this is going to be part B again. So we're going to start with the relocation test. So I'm going to have him in this nice 90-90 position. We're going to press against the posterior. We're going to press posteriorly on the humeral head and externally rotate. And so a positive for this test is going to be if there's a decrease in pain or an increase in range of motion compared to when you did the apprehension test. Didn't do the apprehension test for this video, but and then an implication for that is going to be an increase in laxity in the anterior capsule, and then that could lead to like capsular damage or even labral tears. No one wants that. And then apprehension test, you're going to get under, stabilize the scapula, put your thumb around here, find that nice coracoid process. We're going to flex the elbow to 90, flex the shoulder to 90, keep it right there, and then you're just going to press down. And so what you're looking for as a positive is going to be any apprehension or muscle guarding, which would make them prevent posterior humeral head movement. And then implication is going to be any laxity of the posterior capsule, or it could even mean that there's a torn posterior labrum. And then for anterior giror, you're going to be supine, and you're going to stabilize that scapula once again. Abduct about 20-30. You're going to flex a little bit. You're going to grab that humerus, and then you're just going to glide that humeral head in and out, in and out. And the positive for that is going to be if there's any clicking that happens, or the patient has any apprehension, or if there's any increased laxity. And then the implication of clicking happening when you're doing this test could be a labral tear, or there could be slippage of the humeral head and the glenoid rim. And the implications of apprehension, or if there's increased laxity, that stuff could mean that there's instability of the anterior glenohumeral joint. And so next we'll move on to O'Brien. So I'll have you stand, por favor, right here. And so for this one, you're going to have them flex their arm, and then have them abduct as far as they can, about 15 degrees, which is what normal people can go like right there. And so we're going to do internal rotation first. So have your thumb down, and then I'm going to stabilize here, and I'm going to put downward force here, and then we'll do it again, thumb up for external rotation, and then we'll press down here. And then for this one, a positive is going to be if there's an increase, or if there's pain or popping with the internal rotation, and then if there's a decrease or elimination of that painfulness or popping when there's external rotation. And then implication is going to be a superior labral tear or a slap lesion. And then drop arm test. So we're going to have you supinate your forearms. I'm going to have you extend or externally rotate your shoulders, and then I'll have you bring your arms up into abduction. And so for this one, instead of doing them both one by one, it's easier to just do them both arms at the same time, so you can really see the difference. And then yeah, we'll slowly lower his arms. And then a positive for this is going to be if there's any inability for him to get his arms through that full range of motion on the way down, especially at the 90-degree position. And then implications of that could mean a rotator cuff lesion of the supraspinatus muscle. And so NIRS test, we're going to have you in anatomical position, arm, palms out, just like that. And then we're going to internally rotate, and then we're going to passively flex. So I'm just going to stabilize the shoulder, and I'm going to bring this up. And for this one, we're going to apply a posterior force. And then we'll do it one more time. We'll apply a more medial force. So I'll try to push it in more. This way, sorry. Hit your arm against there. And so you're going to do that twice. One, again, posterior, one with medial forces. And then positive for that's going to be if there's any pain when you're putting that overpressure on that joint. And then if there's pain with the posterior overpressure, that could mean impingement of the long head of the biceps tendon or even the tendon sheath. And then if there's pain with the medial overpressure, that could be an impingement of the supraspinatus or infraspinatus muscles, or even the subacromial bursa. And so next, we're going to do speeds test. which is sitting. And then I'll have you have your elbow in extension. I'll stabilize your shoulder here. Yeah, supinate that arm. And then I'll have you press up against my arm. You'll go through. I'll have you scoot over a little bit because you need to be elevated. And so you want them to be at 0 degrees. So we're starting all the way at the bottom, and then you're coming up to 90 degrees. So you want to be parallel with the table. So you want to put just enough pressure. They can make it through the motion, but you want to make sure you're making it a little hard on them. And so positive for that is going to be if there's any pain or popping along the long head of the biceps or within the bicipital groove. And the bicipital groove is where you're holding onto up here while they're going through the motion. I don't think I mentioned that. And then implication could be inflammation of the long head of the biceps tendon, or that could mean there's any kind of damage to the transverse humeral ligament. And the Ludington's test, hands on your head, interlocked. Just scoot this up a moment. Hello. Yeah, so hands on your head, interlocked. And so once again, you're going to come in here and feel the bicipital groove, and I'll have you contract. Yep. And so a positive for this test is going to be if you don't feel any tension underneath the tendon that you're palpating, or if the pain is increased, then that's a positive. And then implication is going to be a rupture of the long head of the biceps tendon. And then last two tests, the first one is Adson's maneuver. So again, seated, what you're going to do is you're going to abduct about 30 degrees. You're going to extend, but first you're going to find that radial pulse, which is like right there. And so you're going to abduct about 30 degrees, you're going to extend, and external rotation. You want to make sure you keep that external rotation. Extend as far as you can, and then I'll have him turn his head towards me. And then I'll have him extend his head back, and you'll hold that for about 2 minutes. And a positive for this is going to be if the distal radial pulse either dramatically decreases or completely disappears altogether. And then an implication for that could be occlusion of the subclavian artery between the middle and the anterior scalenes and the pectoralis minor muscles. And then the last one is the military brace position, so I'll have you stand up again. And so for this one, once again, find that nice radial pulse right down there on the wrist. And then I'll have you retract your shoulders, so bring them together, shoulder blades. Then I'll have you depress your shoulders in that nice attention position. And then we'll abduct about 30 degrees, extend, and then we'll just have him extend his neck. You'll hold that again for about 2 minutes and see what happens. And then positive for this is going to be, again, distal radial pulse disappears or it decreases dramatically. And then implication for this is going to be the subclavian artery is blocked by the corticoclavicular structures of the shoulder. And that's it for that video. Thanks.